Hi everyone, welcome again to my Cystic Fibrosis YouTube channel. Hope you're all well. Today I'd like to talk to you about cystic fibrosis at a high level. There is an abundance of information on the internet about this complex disease, and what I want to do for you today is an abridged video to set the scene about what it is and what a CF patient like myself can experience. Cystic fibrosis is one of the UK's most common life-threatening inherited diseases, and it is caused by a genetic mutation that means cells in the human body are unable to move salt and water around effectively. As a result, the internal organs, especially the lungs and the digestive system, become clogged with this thick, sticky mucus, resulting in chronic infections and inflammation in the lungs and difficulty digesting food. But CF is much more complex than that. And this illustration, which you're seeing right now, provides a single pane of glass overview of how cystic fibrosis can manifest in the body. There is a lot of information in this picture, and I invite you to pause the video right now so that you can scan through the details. In terms of symptoms, there is a very long list of physical symptoms associated with cystic fibrosis. Because there are nearly 2,000 identified mutations of the CF gene, CF affects people in different ways, depending on the severity of the disease. Now, most people with the condition will only experience a handful of these symptoms at a time. I would like to draw your attention to a few key manifestations and how they affect us. So the first symptom I'd like to talk about relates to the lungs. Now, in healthy lungs, there is a thin layer of mucus that helps your body move dirt and bacteria out of the lungs. And in people with CF, this mucus is much thicker and clogs the lungs, as illustrated here. And the mucus, it creates the perfect environment for harmful bacteria. Now, this means that CF people typically experience symptoms like persistent coughs, wheezing, shortness of breath, breathing difficulties, and repeated lung infections. Now, these infections can be serious, that it is common for people with CF to spend weeks in hospital several times a year for intravenous antibiotic treatment and monitoring. Infection can cause a CF patient's lung function to drop far lower compared to someone with fully functioning lungs. For many people with CF, a double lung transplant becomes the only option when existing treatments stop having an impact. The next symptom I want to talk to you about relates to the digestive system. Now, the same thickened secretions also block the pancreas, which you can see on this illustration here. Now, the impact is that food cannot be absorbed properly. This can cause malnutrition, which can lead to a variety of symptoms, including poor weight gain, bloated abdomen, and severe stomach aches. Now, staying with the pancreas, this organ can become scarred and inflamed, which impacts the ability to effectively produce insulin. This triggers something called cystic fibrosis related diabetes, which is similar to type 1 in that it is treated by insulin injections. The same mucus can also collect in the sinuses, which can lead to pounding headaches along with a loss of sense of smell. And the last ones I wanted to mention to you relate to the liver and the bones. The small ducts in the liver can get blocked, which can lead to liver disease. And there's always a chance that our bones may become thinner and weaker, leading to joint pain, arthritis, osteopenia, and low bone mineral density. Now that you've seen a high-level overview of some of the key symptoms, this would be a good time to give you some insight to the overall number of registered cystic fibrosis patients in the UK. I dug this information out from the most recent UK statistics report by the CF Trust. And as you can see, as of 2019, there are over 10,000 people in the UK who have cystic fibrosis, which works out as roughly 1 in every 2,500 babies born. And globally, there are over 100,000 diagnosed with CF. Now, just drilling a bit further into this data, it is interesting to see that 93% of this UK CF population are white. Just under 3% are Asian, 0.2% are black, and just over 1% are of mixed heritage. This is interesting to me because originally my parents are from Bangladesh, and this does go a long way to explain why I never used to see Asian CF patients either in the wards when I was admitted or in the outpatient waiting areas in the hospital. Being an Asian with CF does present lots of social challenges. And in my opinion, that is because it is not very common and therefore leads to misunderstandings of this disease. So now that we've seen this data, the question beckons, how and what are the chances of a baby being born with cystic fibrosis? And I'm going to dive very briefly into genetics. Now, every person on the planet, including yourself, whether you have CF or not, has a gene in your body called the Cystic Fibrosis Transmembrane Conductance Regulator, or CFRT for short. And you'll have 2 copies of this gene, one from your mother and one from your father. In cystic fibrosis, a defect or a mutation in this gene, it changes a protein that regulates the movement of salt in and out of the cells. The result is that thick, sticky mucus that I mentioned earlier that affects the body, including lungs, sinuses, and digestive systems, as well as causing increased salt in sweat. So that is a very, very high overview of the CF gene. And the next illustration I'm showing to you right now summarizes nicely how it works and the probability of having a child with CF. To walk you through this, I would like to just explain to you first what a carrier is. Now, in order to have CF, you need to have inherited 2 copies of the defective CF mutation, one from each parent. Both parents must have at least 1 copy of the defective gene. People with only 1 copy of the defective gene are called carriers, but they do not have the disease. So just to give you an idea of the scale of number of carriers globally, it is approximately 1 in 23 of the general population, and that is 12 million people. Now, each time 2 CF carriers have a child, these are the chances you see in front of you of a child having CF. 25% or 1 in 4, the child will have CF. An increase 50%, the child will be a carrier but not have CF. Or 25%, 1 in 4, the child will not be a carrier and will not have CF. The underlying thing to stress here is that cystic fibrosis is not contagious. You can't catch it like the cold or the flu. even though we will exhibit symptoms similar, such as fevers, chest infections, and persistent coughing. And interestingly, in the current COVID climate that we are all living in, a lot of CF symptoms overlap with COVID's, but that doesn't mean that necessarily we have COVID. So this concludes my introduction to you about cystic fibrosis. I haven't covered absolutely everything. As I mentioned at the beginning of this video, there is a lot more to this disease due to its complexity. But what I've spoken to you about today will hopefully set the scene and provide you with initial understanding of CF. I also haven't mentioned anything about treatments, and that's because there is no cure currently for CF, and daily maintenance and management of this disease are a critical part of a CFer's life. And so I want to do a separate video, short video, about what I do for my own treatments. If you are interested, there is a film on Netflix and Amazon Prime called 5 Feet Apart. It is a romantic drama about two cystic fibrosis patients who fall for each other. And it captures a lot of the core CF elements from both a medical and social perspective. It's called 5 Feet Apart because CF people should never meet in person. And there is a risk of cross-infection and the potential to pass harmful bugs to each other. And to wrap up, I have done a couple of story videos on my YouTube channel about the journey towards my late CF diagnosis and about trying to earn a living whilst coping with CF. The reason why I've done them is because it's not easy at all living with cystic fibrosis, medically, socially, or emotionally. And the aim of my stories is to give you additional insight to not only how cystic fibrosis can affect medically, but the social and emotional challenges that come along as well. If I could ask one thing of you, please, the audience, and that is for your help to raise awareness amongst your friends and wider circles by subscribing to my channel and sharing this video. It's really important to me, well, not only to me, but also the global CF population, that this chronic limiting disease gets as much visibility as possible. Cystic fibrosis tends to get worse over time and can be fatal if it leads to serious infection or the lungs stop working properly. But people with CF are now living longer because of advancements in treatments. And according to the NHS website, currently about half of people with cystic fibrosis will live past the age of 40. So that's it, folks. Thank you so much for watching. I really appreciate that you've taken the time out. Take care, and I'll see you again soon. Bye-bye.